Yogi Berra once said, if you don't know where you're going, you're going to end up somewhere else. Now, he was sort of a comic, philosopher, as well as one of the best baseball players, if not the best baseball player of all time, catcher for the New York Yankees, back in their heyday when he won something like 11 World Series. He also said, if you don't know where you're going, any road will take you there. Now, what does this mean for dentistry? I think it's important to comprehensively treatment plan all of our patients. I think it's important to comprehensively treatment plan where we're going to go in our own lives. Most people don't take the time to do that. In dental school, we were given a certain protocol to treat. Some of us were treating comprehensively, some of us just learned procedures. And as you know, if you've listened to me before, I think it's very important that we not be procedure-oriented, but more comprehensively oriented. And what does that mean? All patients receive a comprehensive examination, and they all receive a diagnosis. And it can be only one true diagnosis. And there really should be one true comprehensive examination where we look at periodontics, caries, the bite, aesthetics, ortho, etc., or cancer exam as well. So it's important that we treat comprehensively, and then that we give the patient a series of options. And that is basically our framework of where we're going to end up going. Most of us don't do that. We're influenced by patients. And as I've said before and previously, do you sometimes do the treatment that the patient wants to do, even though it's not the right treatment? Would you do the same treatment? If a patient comes in and says, just treat this one tooth, but ignore the periodontal disease that's in your mouth, or just treat this one tooth, and I don't care about the aesthetics over here or my bite. And by treating that one tooth, the patient's going to be worse off in the future. But that's what the patient wants. But the patient has no idea. The patient has no idea because they didn't go to dental school. They don't treat comprehensively. They just want to get in and out. Their desires are going to be very different than yours, or maybe mine. So I think it's important that we treat comprehensively and we develop a plan. Otherwise, we're going to end up someplace we didn't want to end up. And being in the same location for the same number of years, I've been in the same location in downtown Fairfield, Connecticut for 40 years. So anything that I've done 40 years ago, if the patient's still alive, they still want to come back, if there's been a problem because of what I've done, they know exactly where I live. They say if you want to be a really successful dentist, move your practice every 3 to 5 years. You'll never see any of your problems. I have the luxury of being in the same location for 40 years, so I get to see my problems. Why is that important? Because I see what works and what didn't work. And what I have found is when I treat comprehensively and I do the right thing, and we follow the biological principles of basically controlling bacteria, controlling forces of occlusion, good oral hygiene, getting patients on recall, things work out pretty well. I have an old car, I have an old house, I got an old office, but you wouldn't know it's old if you looked at it because we're taking care of it. I have a lot of old patients too that I've been treating for 30, 35 years. And the ones that come in every 3 months and followed my advice, brush and floss at home, don't eat a lot of sugar, see the hygienist every 3 to 4 months if needed, they seem to do pretty well. So just remember Yogi Berra's advice. If you don't know where you're going, you're going to end up somewhere else. We as dentists are fortunate to be lifting up on the shoulders of all the people that came behind us, all the giants that came behind us, who've taught us what to do. We don't have to make this stuff up, and we know what works. We've known for a long period of time. We don't know that in a lot of other fields. I can't give you great dietary advice, but I can give you good dental advice. Brush and floss daily. Tell patients everything they need to know about their future treatment. Do the right thing, because it is the right thing, and continue to be the gift to your patients. Have a great day, everybody, and thank you for listening.